On the 13th of April 2003, a gray sky hung over the small coastal city of Richmond as Michael Luby and his wife Boulanger walked their dog along a piece of the city's marshy shoreline. A heavy storm thrashed the breakwater with strong winds and heavy rain the night before, leaving a widespread field of debris strewn across the mudflat where they now strolled. The wind still pushed a steady breeze through the marram grass as their Weimaraner led the way east along the rocky coastline when the dog suddenly stopped, distracted by something lying in the weeds. Michael soon caught up, realizing that the dog had made a heartbreaking discovery. A tiny pale body lay in a puddle of water, just 25 feet or so from the breakwater, carelessly discarded there in the marsh grass alongside countless bits of trash. Boulanger hadn't yet realized why Michael stopped walking, but saw the terror on her husband's face as she approached. A few steps more and the cause of his trepidation was clear. The two of them hastily turned back the way they came, but now, nearly a quarter of a mile from the bike trail where they'd started their walk, it took them some time to make their way back to a phone. As they drew closer to the neighborhood bordering the trail, Michael's eyes scanned for signs of life among the last row of houses, still roughly 200 yards away. Spotting some men working outside of one of the upscale homes along Seabreeze Drive, Michael closed the distance, with his wife Boulanger and their dog not far behind. Fire Captain Eric Newman was dispatched on Engine 67 at 4:53 p.m. He arrived on scene with 3 crew members just 4 minutes later. Captain Newman briefly met with the homeowner at 25 Seabreeze Drive, where Michael had seen the men working outside and told them to call 911. Newman then jumped the fence at the back of the house with his crew and medical gear in tow and began the quarter-mile trek back down to the shoreline with Michael, Boulanger, and the dog. But Newman's dispatch had been unclear, and it was only after speaking to Michael along the way and seeing the state of the baby that Captain Newman realized there had been no need to bring the medical bag. This wasn't a rescue call. The child lay on his back facing southeast. His pale white skin was ripped open at the shoulder, making his right arm appear dislodged, if not completely dismembered. Captain Newman estimated the age of the infant to be anywhere from 6 months to a year old. His little body came to rest amidst one of the many strands of debris snaked across the marsh, as if the ocean had drained across the mudflat like a filthy bathtub, leaving waterlines of trash and dead vegetation behind. Newman contacted the Richmond Police Department to respond to an infant DOA along the shoreline, and he and his crew did all they could for the baby. Keeping their distance, they secured the area to preserve the evidence and watched over his tiny body until Richmond PD officers could arrive. The Luby's dog paced as the couple waited nearby until Patrol Officer Todd Updike and Evidence Technician Officer Tim Gard arrived at 5 p.m. After giving Officer Updike a quick report, Captain Newman and his crew left the scene at 5:30. Officer Gard began taking photos and scanning the area for potential evidence, while Officer Updike conducted separate interviews with Michael and Boulanger. Homicide Evidence Technician Detective Dave Solar arrived at 6:50, and after a briefing from Officer Gard, took over the case. Detective Solar continued to photograph the scene on the ground, while a police helicopter took aerial shots from the sky, and he and Updike searched the area for evidence that may have been connected to the baby. Ultimately, they didn't collect anything from the marsh or the rocks, but Solar did document a piece of evidence that was attached to the body itself. A piece of twine or fibrous tape ran under the arm around the baby's torso and was tied around his tiny neck. Solar and Updike worked the scene until Deputy Chris Martinez arrived from the coroner's office at 8:15. Though it's not clear exactly when Michael and Boulanger left the scene, it seems they remained there for quite a while, as they and their dog are captured in several of the crime scene photos taken that evening, suggesting they stayed as long as they could to try to help. Detective Solar requested for Deputy Coroner Martinez to wrap the baby in a blanket to preserve the evidence, and by 8:40 p.m., Martinez had the blanket secured on a gurney for transport. Solar trailed Martinez to the coroner's office, where the baby would be put into cold storage overnight, but he would return at 8 a.m. the following morning to document the autopsy of Baby Doe. Dr. Brian Peterson, forensic pathologist for Contra Costa County, began his examination of the body at 8:10 a.m. on the 14th of April. One of the first things he noticed was that the skin was quite soft and very pale, in keeping with maceration, the softening and wrinkling effect on the skin after being soaked in fluid for a long period of time. The doctor found no remnants of vernix, which is the waxy white substance that acts as a protective barrier between a newborn's skin and the waters of the womb. There was a tear near the right shoulder that exposed skeletal muscle and the structures beneath. It began at the right shoulder and extended into the abdominal wall, causing portions of the small and large intestine to protrude through the wound. There was no evidence of animal feeding, no scalloping or curved marks around the edges of the wound, and Dr. Peterson concluded that the soft, fragile tissue had torn or been pulled apart due to tidal action or contact with an object in the water. He was certain the injury had been inflicted post-mortem. Moving on with his external examination, he carefully observed and measured what remained of Baby Doe's umbilical cord, noting that the half-centimeter portion of tissue appeared to be ripped or torn, rather than clamped or cut at the end. Upon birth, the cord must be clamped or closed off to prevent the newborn from bleeding to death. Baby Doe's cord was significantly damaged by the same maceration that had softened the rest of his skin, but the tissue at the tip had turned black with decomposition and began to crumble. Peterson noted that because the skull bones were not yet fully formed, they'd shifted under the skin, causing deformity. Decomposition and maceration softened the brain, allowing for the skull to partially collapse along the forehead, and leaving Dr. Peterson unable to take a measurement of the head circumference. At this point, Dr. Peterson began his internal examination of Baby Doe. The organs in general were soft and mostly liquefied, in keeping with the decomposition and maceration level. The spleen and kidney could not be weighed because they'd been completely dissolved. The liver, which is generally proportionally larger than other organs in infants, suffered a substantive loss of tissue due to the maceration, causing Baby Doe's stomach to appear rather flat. There was more liquefaction inside the right side of the chest as opposed to the left because of the tear. The damage there was still the result of decomposition and immersion, but had been accelerated without the protection of the skin. The organs appeared to have developed normally, emerging as nearly ordinary on the exterior, but weighed far less than they should have due to the post-mortem liquefaction of the interior. A piece of the colon protruded from the body, and after examination, Dr. Peterson was able to find meconium still present there. A newborn's first bowel movement typically consists of the green pasty material, and babies under distress in the womb can sometimes release meconium into the amniotic fluid, causing issues with the lungs after birth. But Baby Doe's meconium was still present in the colon, indicating he hadn't yet made his first bowel movement. This touches on one of the most vital questions Dr. Peterson set out to answer with his exam. Had Baby Doe ever survived outside of the womb? While he was able to provide investigators with several clues pointing in a certain direction, unfortunately, he wouldn't be able to give a definitive answer. In connection with Dr. Peterson's exam, we should mention a commonly referenced theory here called the float test. The float test is used to determine live birth, with the idea that if the baby is stillborn, it has never had a chance to draw breath, and thus the lungs are heavy and simply will not float in water. On the other hand, if the baby is alive born and has drawn breath, the lungs are expanded, there is air, and they will float. The problem with the theory is that there can be postmortem gas formation in the lungs due to decomposition, and while we don't know the state of Baby Doe's lungs, Dr. Peterson has never relied on the float test and did not perform one in this case. He did, however, perform a vital reaction test on the jagged end of the umbilical cord. More of an observation than a test, really. A vital reaction in the tissue is simply a fancy way of saying signs of healing are present. In other words, if you can identify the formation of a scab on the skin at the microscopic level, you have evidence of a vital reaction in the tissue. Peterson found no such evidence on baby doe. Nor did he find any indication of feeding. The stomach was empty with no traces of curdled breast milk or formula. This brings us to what some might say is the most obvious sign that baby doe not only lived outside of the womb, but was handled and potentially killed there: the length of tape looping his torso and knotted around his neck. There were 1.5 loops of the tape wrapped and knotted near the left shoulder, leaving just 2 centimeters of slack when pulled snugly to one side. The gap wasn't near long enough for the doctor to slide the loop over baby doe's head to remove it without causing significant damage, so he cut the tape. But how did it get there if the loop was too small to slip over the head? And how do we know it wasn't used to strangle baby doe after his birth? A large part of the answer to that lies in the condition of baby doe's neck. Thorough examination of the exterior layers of the skin, the interior layers of the muscle, and the voice box revealed no signs of injury. There were no furrows in the skin, no signs of bruising, and no damage to the muscle or the cartilage, ruling out both ligature and manual strangulation. As far as how the tape came to rest where it was, Dr. Peterson concluded the association between the body and the tape was coincidental, opining in his notes that the material had simply wound itself around the body, under the arm, and became knotted and perhaps tightened later around the neck. The tape was collected by Detective Solar and sealed for storage in an evidence locker. But there was another mysterious item removed from baby doe at autopsy that would later lead to speculation about whether he'd been handled outside of the womb. A black material clung to his skin tightly enough to fold the left ear down flat, plastering it to the side of the head. The dark strip of jagged material had been stuck there long enough to deform the ear, causing the soft cartilage to remain bent even after it was removed, and leaving behind a faint purplish stain on baby doe's skin. Unfortunately, Detective Solar didn't collect the mysterious black material, and it was never placed into evidence. Though that was mainly because upon inspection, there was no mystery. He identified it as either seaweed or kelp and discarded it along with the other inconsequential organic material from the blanket baby doe was transported in. But because the material hadn't been saved, it left room for later questions about what else it could have been, and conjecture grew around a theory about electrical tape and whether the darkened discoloration left on baby doe's skin could have been residue from the adhesive. Of course, this would indicate the tape had been placed there after his birth, though what reason a person might have to fold down the baby's ear and tape it there is unknown. But Dr. Peterson also identified the material as dried kelp or seaweed, noting a further bit of useful information about sea kelp in particular. It contains a high amount of iodine, likely contributing to the purple staining behind baby doe's left ear. Although he weighed just 1,160 grams, or roughly 2.5 pounds, Dr. Peterson opined that baby doe had reached full term by the time of his death. He'd lost a considerable portion of the mass in his organs due to the liquefaction and decomposition, which significantly decreased his weight. The crown to rump was 32 centimeters, or roughly 17 inches. And although a crown of head measurement could not be taken due to the collapsing skull, it was based on these measurements that Dr. Peterson estimated baby doe's gestational age to be around 9 months. However, baby doe was decomposing in general terms, and as tissues decompose, they tend to expand, potentially affecting the whole body. For this reason, further testing was needed to pin down his gestational age, causing Dr. Peterson to call on Dr. Allison Galloway, a forensic anthropologist, to provide a more precise determination. In order to do so, Dr. Galloway collected several of baby doe's bones for examination and measurement. The right humerus, which is the upper arm bone, the right femur, which is the thigh bone, and the right tibia, which is the shin bone. The humerus measured 58 millimeters, or 2.3 inches. The femur measured 63.8 millimeters or 2.5 inches, and the tibia was 57.5 millimeters or 2.2 inches. Dr. Galloway's measurements provide a range between 33 and 40 weeks, with the average establishing baby doe's gestational age to be roughly 36 to 38 weeks old. Dr. Peterson classified the cause and manner of death as undetermined and was unable to conclusively rule out a live birth. But while he was unable to establish whether or not baby doe had ever taken a breath due to the post-mortem change in his lungs, he confidently opined that baby doe would have survived outside of the womb, had he been given the chance. Peterson also concluded that baby doe hadn't been in the water for much longer than 2 days, theorizing that if the small body had been left to the mercy of the tidal motion and sea life much longer, there wouldn't have been anything left of him to find. Thanks so much for watching. If you enjoyed the episode and want to hear more stories like these, give it a like and subscribe to the channel before you go. Don't forget to leave your thoughts in the comments and check out our website and social media links down below. As always, until next time, stay safe, be kind, and memento mori.